Hi, my name is Adam Bennett. I'm a sports medicine physician. I'm currently the medical director for the new sports medicine clinic on Maple Avenue in Evanston. I think this is a great investment in Northwestern medicine because we have a very well-established North region in Lake Forest Hospital and a very well-established Central region in downtown Chicago. It's a great spot to sort of marry those two locations, provide excellent care for the patients in the local community. It's more convenient for people who live in this area, but also need subspecialty care. Also, Northwestern Medicine recently joined with Northwestern University. So having a place right here in the backyard of Northwestern University to provide care for students and faculty, I think is a great idea. So patient care at this location, I think, is phenomenal given the fact we have clinical providers, we have radiologists, and we have physical therapists. If you look at every professional team, in my experience in the NFL and other teams like Major League Baseball, when an athlete's injured, they often are seen right away by a doctor. They then get an MRI the same day or next day, and then they're starting their rehab within 1 to 3 days. And that's what's happening here. We're providing that level of care to local athletes. You know, these families are putting in thousands of dollars in club sports. And when they're injured, they don't know if they can go to a showcase in 2 or 3 weeks. Us seeing them in clinic, getting the right diagnosis with the MRI as soon as possible is key. And that's what's happening here. So this model where we integrate different specialties, namely radiology and orthopedics, I think can benefit the system significantly. We get patients in quickly, we get same day or next day MRIs, and the efficiency when it comes to patient care, I think, is really the standard that we're looking to emulate. So if we can get other areas of Northwestern medicine doing the same thing, I think it's going to be a big win. So defining success for this location, I think I look at a variety of ways. Number one, we're taking great care of the community. We have athletes that can get in here quickly. They can get their imaging done quickly. I think that is key, and that's a differentiator for us here. And I think that's something we're going to do very, very well. I also would define success that the people that work here are very happy and are seeing the right patients and providing the care they're capable of. So I think those two things are, to me, how I define success at this point. So as medical director, what excites me about this clinic, there's a variety of things. I think one that's very clear and unique is that we have athletic trainers that staff a lot of our clinics, meaning these are athletic trainers that are very well versed in musculoskeletal care. They're sort of the first line people out there in the fields and sports, and now they're working in our clinic. So they know a lot about musculoskeletal care, and they're the ones who are talking to our patients on the phone, who are getting them in for x-rays, who are giving them their MRI results, helping work with the physicians to coordinate care. That's very unique. The others, I think we have imaging in the same building, and which means if I have a patient needs an MRI same day or next day, I can get it done quickly. I can talk to the radiologist. Already I've had dozens of patients that I'm calling them that afternoon. I saw them that morning and I have their MRI at noon, and I'm giving them the results just a few hours later. So patients are very, very happy about that, and that makes me happy as the medical director. So the field of sports medicine is growing in a variety of ways. Number one is that when it comes to providers and people that we're training, we're getting younger people coming into the field who are very well trained. They know all the latest and greatest when it comes to diagnostic tests, treatment options. And on top of that, we have a lot more younger people who are playing sports. We call it the professionalization of youth sports. We have these kids that are playing multiple teams, multiple clubs, are trying to play at college or beyond. And so we're kind of bringing those two facts together. We have athletes there's a lot more of them and they're younger, and then we have providers who are better experienced. So I think both are growing, and it's nice because they need to be growing together. So as a Northwestern alumnus, being back in Evanston is fantastic. I played soccer in college and I was captain, and I was injured, and so I was very involved with the team a number of times with an injury. So that's why I became a doctor. But to come back here and provide medical care for this community is fantastic for me. My wife also played field hockey at Northwestern, so purple runs in our blood. Northwestern athletics in general, I think, does a fantastic job of preparing their student athletes. I've seen that in NFL. Whenever I'd see a Northwestern player in the NFL and I got to meet with them and talk with them, you could always tell they were a little bit more prepared in life than some of the other players. And I'm really proud of that. I think that's something great about Northwestern University. So to be back here doing sports medicine in this location is a dream. My name is Adam Bennett. I'm a sports medicine physician. And if you'd like to hear more about our clinic, go to our website, nm.org/sportsmedicine.